is one aspect that we have not covered yet today, and that is the orthopedic view on EMS. Ask your doctor for risks or side effects. You know that saying, don't you? And in this particular case, we have Dr. Bernd Wegener. He is a doctor in Munich for vertebral column and foot surgery. And he will talk about rehabilitation using electric stimulation. And there's also a study about to be published, but best is you listen to what he has to say from the specific orthopedic viewpoint. Professor Wegener, you have the floor. Now comes the guy who actually spoils it all after you've heard what you can do. But let's see the scientific view. When we talk about whatever, we need a picture, we need a chart, and that chart is gone to start with. Maybe a technician could help me out? Yeah, okay, let's go for this one then. When we actually look at a problem at a university, then we first research serious data about specific topics. Here, for instance, I have searched the term whole body EMS. There are 12 papers on this, and then I would, of course, check what deals with my specific specialty, orthopedics. Nothing. So let's spell it completely. Whole body electromyostimulation. So I find 18 studies, and the 12 studies I showed before, of course, included in the 18 studies. But there's nothing really referring to orthopedics. So let's study what we can find. There's a number of studies that deal with sports aspects. And there's even more than the 18 studies when you look at sports medicine. Then neurorehabilitation, then cardio, then kidney problems, then sarcopenia studies, osteoporosis studies. And I thought, great, this is part of my discipline. I'm going to talk about this. So I looked at the study, and I found Professor Kemmler in the agenda of today. He's the author of this paper, and he's going to present his own talk. So what is left for me to do for orthopedics? Zero. Nothing. So why not actually search the term Kemmler, Professor Kemmler? There is about 100 studies on various topics, including, among others, sarcopenia. So this is the aging of bone mass, muscle mass, and impaired mobility. Professor Kemmler will talk about this in his talk, and this is why I will refrain from doing this. But I thought, well, what could actually refer to my discipline, orthopedics? As I said, this is particularly foot and ankle disorders and vertebral column deficits. So let's go for back pain. So look at a combination of EMS, whole body EMS, and back pain. Let's look at whole body EMS and arthrosis of the vertebral column, electrical myostimulation, and back pain. Search results too. Let's look at it in detail. And the studies mentioned here, nothing for me, which is really a shame. So there is hardly anything about whole body EMS and back pain. Were you here before? Then you will have known or will know that there's so much talked about it. Why don't we find anything in scientific literature? Well, there's lots of empirical data, some even long-standing data, but the hard scientific evaluation is missing. The hard scientific facts, playing with significance rates and control groups. This evaluation is, however, necessary in order to divide between or make a distinction between coincidence and facts. Unfortunately, there's nothing available here. So let's go for the keywords: sarcopenia, muscle mass, muscle power, osteoporosis, fracture risk, bone density, and CK, kidney failure. Let's talk about medicine straight away and see what we have in terms of electrotherapy in medicine. There is what we heard about before in the antiquity. We found that there are animals with current and people that are reacting to this, and that people are capable of doing extreme things. They actually place the electric ray on people's heads in ancient times. But this is, of course, applications that go back to our time. So people with painful extremities were placed on these poor animals until they no longer felt their legs and the pain was gone. On the other way around, when somebody actually suffered from headache, the animals were placed on the head. And the animals were left on the head until the patients no longer felt any pain or anything else. And this then actually was left to its own resort for 1,700 years. But then, all of a sudden, the work started becoming interesting, and some serious findings came about. And in the early days, funny examinations were made, showing that you can treat patients with those surface electrodes. This was more of a comedy type of treatment, but we also had the high-frequency radiation. When you remember a few years back, there was a discussion at the armed forces about soldiers in contact with radar systems, and certain disorders were considered as professional diseases. Well, radar is also high frequency. Then in the 70s, this made inroads in sports medicine, first among Soviet athletes, later on a global scale. And in terms of muscle stimulation, it was an old hat, because way back in 1910, Bergenization was applied to actually stimulate muscles. It was sold as aesthetics. But only in 1970 we really understood what this was all about. Then the acupuncture systems all of a sudden used electrical current in the 70s. Unfortunately, I have to catch up in time. The direct current application was used for pain therapy. It stimulates circulation, and this is why it is used as electrophoresis. This is direct current making drug penetrate deeper into the skin, because the skin is there to protect us against this. And with the help of electrostimulation, we can actually introduce drugs more deeply, 3 to 4 centimeters into the skin and through the skin. All of the good ointments from your pharmacists won't do the trick. Then hydrogalvanic baths were applied for painkillers. This brings us to low-frequency therapies. This is everything below 1 kilohertz. And again, there are various applications. There is muscle stimulation, the way we know it from EMS, but there's also transcutaneous electrical nervous stimulation, TENS, that we know from pain therapy. And you can work musculoskeletal pains, so nervous pains that are actually caused by, at times, very hard to define changes in your body. Then there's the medium frequency current that helps circulation, increases circulation, and therefore relaxes muscles, and therefore relieves pain. Then high-frequency therapies are like this. This is a microwave application. They produce heat, and this actually, like a fungo treatment, actually relaxes the muscles and therefore relieves pain. Now, let's come to my favorite topic, back pain, systematic back pain. There's nothing systematic about this, and this is the problem. There is a hodgepodge of terms that we mix up, and everything is actually summed up as back pain, and nobody really knows what we're talking about. And then there's this, the Olymp of back pain therapy. We start with the diagnosis, we continue with physiotherapy, then provide injections, have a whole repository of minimally invasive operation techniques, and up on the Olymp, you've got the surgeon, the specialist surgeon for column vertebra. And very often we've missed out on the target. We've not achieved what we wanted to do, and that is to relieve pain. This brings us back to the beginning, and this is the pain therapy, and this again brings us to measures such as TENS or EMS. Let's try to break down back pain into causes. Scoliosis, forget about that. There are degenerative reasons, but there are also inflammation causes like tuberculosis. It still occurs, and there are also back pains that are not caused by the vertebral column, because there's a lot of psychological reasons. You're all aware of the problems that we bend our backs under load, workload. This is a problem you need to discuss. So when you actually talk to a back pain patient, then you try to find out, is this acute or chronic? Fingers away from acute back pain. Even if there's local and radicular pain, I still believe that this is a generalized type of pain, and this is why we started the study to verify this. Local or radicular along the root of the nerves, this is all critical. Then the pain character is important. What is the type of pain and how is this disseminated? This is a patient who showed us where the pain is. He's got pain all over the place. And we've, in diagnosis, we've got the yellow and the red flags, and they should be taken into consideration. When such a patient actually contacts you at the club, then you have to be really alert and actually send your patient to a doctor. The red flags show a serious problem with the column. There can be tumors, but there can also be prolapses that qualify as reasons. So take it seriously. Whatever you have in terms of higher temperature, for instance, pain during the night, all of the things that cause paralyses, this must alert you. So you must know there is a problem involved. The yellow flags, this is patients that often not only have structural problems, but also a psychosocial problem. And this is why the pain back is a chronic pain for them. Back pain is not only back pain. I actually pointed out this difference between chronic back pain and acute back pain. There are various reasons, and some reasons are fatal. And this is why this should not happen in your studio, out of all places. Aorta aneurysm, heart attack, lung embolism, this can all cause a back pain. The aorta aneurysm, abdominal aortic aneurysm. This is a serious problem. When I studied, and this is quite a number of years ago, there was this 50% rule. If they open up, if they burst, then 50% die until the emergency doctor arrives. 50% come to the hospital. 50% of them actually come to the OR, and 50% of those patients actually leave the OR alive. And when you have somebody with chronic back pain, send them to the doctor, have a diagnosis, try to avoid such people in your club. This is not a good marketing tool for you. Back pain is also a side effect of 40% of heart attack patients. If somebody does not feel all right, don't judge those people. It may be a patient suffering from a heart attack. And back pain can also be a result of a trauma. Not every trauma must be tough. Not every trauma is fall related. People are getting older. The demands, the personal demands are getting higher. And even older gentlemen break their vertebra, and this is painful. Everything available on back pain is in this care guideline for back pain. The brief version has 100 pages, the long version has 300 pages. Let me summarize briefly. For various therapies, there is an evidence that is high, so it proves that it helps, and there's a low evidence where we can actually apply therapies that are well established, but we're not really aware whether they help or not. What we do know, what helps is that to actually stay active, to do movement therapy, to apply relaxation techniques, then education, of course, back school, and then, of course, behavioral therapy. At times, drugs also help, painkillers, but we have to think about them because the effect can actually dwindle over time. But the core message of this guideline is move, 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 always stay in motion. But now the problem is that our classical patients that come with back pain are usually 1.5 meters too short for their weight. So how do you move those guys? This is a serious problem. You tell them you have to lose weight, you have to move, but they don't do that because they also suffer from other problems. They have back pain, they have hip pain, they have knee pain, they can't move. And the more you tell them what to do, the less you will make them move. Here, EMS is a wonderful offering. Here you can actually make people move who would otherwise never become sporty. With a brief, intense training, you can make them move. You can strengthen the muscles, you're burning some fat, which is also helpful at times. And in this way, you can actually move people to improve their coordination and actually build muscles. And to round off the topic, there is, of course, more diseases and disorders that can, of course, be treated with EMS. Be this the marathon ladies here, be it professional sports people. This brings us to the rehabilitation of musculoskeletal disorders. And there's a huge range also for neurodegenerative disorders or neurovascular disorders. The apoplex, for instance, this is probably for next year or for the next talk. So let's sum up. Real evidence for EMS working for back pain is really low. It's very weak. But it does not mean that it does not work at all. No. Please always remember that the classical back pain, which is unspecific, and I can't prove it, is a super indication to start with EMS training. But always remember that everything that looks strange, that is acute, that is very strong in terms of pain should alert you, because probably there are other problems involved that actually require physicians' diagnostics. And EMS for sports rehabilitation does make sense. The effect for discipline-specific training is clear. Thank you very much for your attention.